The New York, New Jersey Clinical Education Consortium's How-To Guide for Clinical Instructors. This is part 2 of a 3-part series. In Module 2, we will discuss some helpful hints for the student's first day. For this section, it is assumed that you have watched part 1 of this series, Planning for the Learning Experience, and that you have already reviewed material sent to you from the school. This information should include a clinical education policy, information regarding what level the student is and the expectations for that level, the course syllabus and any required assignments the student needs to complete, and a student profile and/or learning inventory. If there are any facility-specific training or orientation materials, these should have already been sent to the student and completed by the student. Example of helpful items to send to a student prior to their arrival are commonly used abbreviations, commonly used outcome measures used in your clinic, articles that may be pertinent to the population you see. The first day, first impressions, first hours. Just as it is important for a student to make a good first impression on you, it is also important for the clinical learning site to have a good first impression with the student. Often this responsibility falls on the CI. It is important to make the student feel like they are welcome and that you are prepared to make this a positive learning experience for them. As a CI, you should be prepared to be at your worksite when the student arrives on the first day and to plan on spending some time with your student alone. Make sure you arrive on time. Remember, you are the student's role model. If you can't be there, delegate the student's welcome to another staff member or assign an activity for the student to do until you arrive. You want to show the student you are prepared for their arrival. Nothing is worse than a student showing up for a clinical experience and feeling like the facility did not know they were coming or was not prepared for them. Make your student feel welcome. Ask them what their preferred name is and introduce them by name to the other staff who are present. Provide them with an area to work and a place to store their belongings. And have an initial private meeting with your student on the first day. In your initial meeting, be sure to review how the student likes to learn and how they prefer to receive feedback. Do they like to observe first, then do? Do they like to jump right in? Or do they prefer to read materials on the topic first? How do they prefer to receive feedback? Do they like it right away or at the end of the day? Unless there's an immediate safety concern, correcting a student in front of a patient can impact the student's confidence and the patient-student relationship. Discuss with your student how you like to supervise. What is your supervision style? Do you give a lot of feedback, or are you more of a hands-off supervisor and only interject if there's a problem? Give your student tips on how to deal with you. Assure your student that they can give you feedback on how you are supervising them or feedback on how to assist with their learning. Review the student affiliate profile and the student's goals, strengths, and weaknesses. Discuss how you can address these goals in your current clinical environment. Also, if there were any questionable first impression issues on the part of the student, for example, arriving late or arriving not in dress code, address them immediately but tactfully with your student. In your initial meeting, it is important to ask your student what areas of clinical practice they feel most prepared and least prepared. Again, discuss how you might be able to improve upon the areas of need at your facility. Review the core syllabus with the student. Identify the performance expectations of the CPI for the student's level and discuss. If you have a weekly outline of student goals to be met each week, this would be a good time to discuss this with the student. Review any expectations of interacting with members of your interdisciplinary team and any individual nuances of particular staff that may ease your students' transition when dealing with them. Review any policies or procedures the student needs the first day or first week. Reviewing all policies and procedures the first day may be overwhelming to the student, and likely they wouldn't remember it. Try to focus on those that are needed the first day or week, such as where to park, where to store personal belongings, work hours, lunch break, schedule, ID badge, emergency procedures. There are a few other first day must-dos. Provide a tour of the work area the student will have to access, including where commonly used equipment is kept, where the bathrooms are, the storage areas, and the nursing units. This would be a good time to introduce the student to key personnel they may need to interact with during the course of their rotation. For example, the head nurse, if this is applicable, the OT, the speech-language pathologist, and other members of your team, such as a discharge planner or social worker, office staff, scheduling staff, or PT aides. An orientation to your documentation should also occur. What is your documentation format and the organization of your medical record? What is the login procedures for your electronic medical record? First day planned learning activities. Make sure you plan some direct patient care activities on the first day. This makes the student feel like they're learning clinical skills, which is the whole purpose of the experience. If they are a novice student and you are truly only comfortable with observation the first day, give them specific things to look for while observing and then discuss after. This makes it more meaningful and worthwhile. Plan some time away from you to give yourself a break and time to get some of your work done. This is a good time to assign a less experienced PT staff member to work with your student on a particular skill. This would be great practice for them in preparing to be a CI, and also an opportunity for your student to work with somebody else. Plan some downtime for the student where they can participate in independent learning, such as media resources or completion of orientation activities. These tips should help you and your student have a successful first day. Don't forget to watch our next video, Managing the Learning Experience, to help you with the remainder of the student experience. Thank you, and good luck with your student. This module was developed in collaboration with members of the New York, New Jersey Clinical Education Consortia.